Welcome to Sports Medicine Weekly on 670 The Score, your on-air resource for fitness, nutrition, and injury prevention and treatments for today's weekend warrior and professional athletes, with renowned specialist of elbows, knees, and shoulders, Dr. Brian Cole, along with other health and fitness leaders, and your host, Steve Cashel. Sports Medicine Weekly, heard every Saturday morning at 8 a.m. right here on 670 The Score.
And good morning, everyone. Here we go, another edition of Sports Medicine Weekly on this Saturday morning. So happy you're with us. I'm Steve Cashel, Chicago Bulls radio host, joined this week with Dr. Chuck Bush-Joseph. He is the orthopedic surgeon, sports medicine specialist with Midwest Orthopedic Rush, filling in this week for one of his partners, Dr. Brian Cole, my usual co-host. Dr. Chuck, thanks so much for filling in. Appreciate it.
Steve, it's always a pleasure here on a Saturday morning.
Great. Well, we got a lot to do. We'll finish it off with our Ask the Doctor segment, always popular. We'll tell you can get involved. But we're going to start right now with a gentleman that I've gotten to know quite well ever since probably August, September, because our sons play on the same hockey team. And I have to give them a little plug because they, not long ago, won the state championship. They're 14U. They play for Bantam AA for the Chicago Hawks. And my son, Corey, and Dr. Bill Hadesman is going to be our next guest here, and Dr. Hadesman's son, Alexander. They were victorious, and now they're going on to South Bend, Indiana, coming up next week. This coming week for the Nationals. They got an automatic entry, so what a season it's been. Hasn't it, Dr. Bill?
It's been exciting. It really has. It's been quite a ride.
And Dr. Hadesman, go ahead.
No, just particularly at such a highly competitive level. It's been fun.
It has, and he is an orthopedic surgeon. You know, you go back with Dr. Bill as well, Chuck, right?
Dr. Bill and I go back almost over 30 years. Actually,
Really?
We both went to Michigan together.
He's from the Hadesman Orthopedics Clinic in Elmhurst. Thoughts on how high school athletes were treated for injuries now and in the past. And, Doc, I want to get into some of this subject as well. Are we seeing an increased incidence in youth sports-related injuries?
Yeah, yes. Over the past several decades, you've seen there's been a dramatic rise in sports-related injuries, and part of it's been fueled by the significant increase in youth sports participation. But another major component is the significant increase in overuse type of injuries, and I'm sure Dr. Bush-Joseph sees all the time. And these are young athletes who are focused more on intense and repetitive, specialized training. It's localized to one sport, and it's year-round. And that has definitely contributed to the numbers.
You know, Dr. Bill, let me ask you this then. When did your son Alexander cone down? Obviously, he's a very accomplished hockey player, and like Corey Cashel, they're really playing at a high level. And Steve and I have had this discussion off and on over the years on this show. When did Corey give to you that hockey was his game as
Alexander?
opposed to other things? Or, I'm sorry, that Alexander. Corey, in your case, Steve, would be interested in the same.
Right. Go ahead, Bill.
When he was younger, he did participate in sports like soccer. We did get involved in Little League, and you know, one of the funny stories, he was playing hockey at the time. In his first year in Little League, he's playing third base. And after the third inning, he comes back to the bench, and there's tears in his eye. And his mother says to Alexander, Alexander, why are you upset? Why are you crying? He goes, I've been out here for 3 innings, and not once has any of the players passed me the ball. I think that I think he kind of coned in on hockey because soccer was not there wasn't a lot of goal scoring. It was a more team-oriented sport, even at baseball at the Little League level. Although of course that changes with time. But we did encourage him to participate in different sports because, as you know, it does help with eye-hand coordination. I think it makes him a better hockey player by playing other sports. But he settled on hockey because he loves the game.
I go the same way. My son Corey, who plays with Alexander on the Bantam AA Chicago Hawks team, It's going to nationals. My son used to play baseball, basketball, football, and hockey, and he's reduced it now just hockey and baseball. He recently made the Napeville Central freshman team, actually playing with the sophomores now, which is great, as a pitcher and first baseman. But it's reduced to 2. But you still, Dr. Chuck, as we talked about, if you can keep in the multiple sports for as long as you can, you really like that, don't you?
You know, I do, Steve, and I think that if at age 14, 15, by that point, kids are well honed in on what they want to do. And so if you get them close to that high school age where they're still enjoying other things, even to a degree, even if it just takes them away from their given sport. And I'm sure Corey, he's happy. He can't wait to get back on the ice.
Yes.
And probably that's telling you then he's ready to go and you're ready to let him to specialize. I got a question of both of you guys. And Dr. Bill, obviously having played both high school and even a bit of collegiate hockey, how do you recognize with your son? When are you going to know when an Alexander has hit his peak? And that's a hard thing as a parent.
Yeah.
You know, we all think that our kids are, have, high level ability, whether it be D1 or even God willing professional. But that's that hard point as a parent. And I'd be interested in when both of you guys think, when do you say maybe this is as high as he's going to get?
Yeah. Go ahead, Dr. Bill.
Well, players are individuals, are kids. Kids mature at different rates, at different levels, and I do think that skill sets are the same way. Some are late inning ball players, so to speak. They come on. Some are naturally talented. Some work hard. It's a good question. The question is, when does he plateau? He's not really playing the game to become a professional athlete. He's playing the game because he loves the game. He loves the competition. He loves the camaraderie. So hopefully that'll never plateau. It all depends on your goals. Are your goals to become the United States Olympic hockey player, play at the collegiate level, play in the National Hockey League? Are your goals to have fun, get better, be competitive, meet a lot of good people, and get a good workout?
Bill, I think I want all our listeners here, that's the right answer. Because the right answer is, maybe you may peak out at your competitive point at some point. And for me, my older brother skated and played hockey. My dad gave up on it by the time I came around. But I played basketball well into my 50s, and not because I was quick or great or had any great aspirations. It was a wonderful workout. It was social. I enjoyed it. I loved it. And I played until my body wouldn't let me play anymore. And hopefully Alexander and Corey get that same thrill. See?
Yeah, absolutely. Well, I see my son continue to improve. He's faster every year, and he's loving it more, and he's watching more hockey. So I remember when he started, he was the worst player on his team back in mites or whatever it was, and now to see him grow to, out of house to travel, and now at a AA level and maybe a AAA level in a year or two if he can, and he wants to keep going. So I'm just going to ride it and say, hey, you know what? He loves it, and I'm never going to say you have to do something, but and I hope he keeps baseball in there too, because I think it's important. I
will tell you, and I think Bill would probably say the same, the kids know. The kids know at one point when they say, all right, I may be at my maximum competitive level. Now I'm going to eventually transition to my recreational level, where I'll get to play hockey recreationally and have fun for the next 10, 15, 20, God willing, 30 years. So I'm sure for you, Bill, you're telling Alexander, you ride that horse as long as it'll run.
Exactly, and I think both you guys make really good points, and I think that's the right attitude too. They're young adults, and they're going to make their own decision anyways. But it's fun that they're motivated, they're competitive, and I want them to strive to be the best, and encourage them to do so.
Again, we're visiting with Dr. Bill Hadesman, orthopedic surgeon from Hadesman Orthopedics in Elmhurst. Steve Cashel with Dr. Chuck Bush-Joseph filling in this week for Dr. Brian Cole. We're talking about our sons because Dr. Hadesman and my son play together AA hockey. And I want to get back to a question here for both doctors here, Dr. Hadesman and Dr. Chuck Bush-Joseph. What steps could be taken, guys, to help prevent or decrease the risk of youth sports injuries? Dr. Bill, you go first.
Well, according to the CDC, the Center for Disease Control, more than half of sports injuries in children are preventable, and that's starting with proper training, conditioning, and equipment. The American Academy of Pediatrics actually has tips for parents that they offer to help prevent, decrease the risk of sports-related injuries. Taking time off, giving the body time to rest. They recommend maybe a day a week, a month a year. Using the right gear, appropriate, proper fitting and protective equipment like pads, helmets, mouthpieces, face and neck guards, of course, protective cups and eyewear. Sports-specific training and regular conditioning are essential. And the regular conditioning should start not during the season, but obviously well before the season. Using proper techniques for the position that a player plays can be very helpful.
Bill, I want to cut you in on that 2 point. And I think that's something that we've emphasized in this show, and I do want our parents to think about. I really can't speak enough about the quality of coaching and how important that is. And I think as parents, we do have to evaluate who's going to be instructing my child, and I got to have confidence in them, because I will tell you, there's good coaching and bad coaching has good results and bad results. And I think that we need to make sure that we're, as parents, evaluating those who are instructing our athletes, especially if especially if they're getting to a higher level like this, where they're playing travel and higher leagues of hockey. That's so important, I think. And really, that's sometimes the difference between frustration by our young athletes and those who are excited and want to continue to play.
Absolutely. We're fortunate with the Chicago Hawks AA hockey team that we have. Tom Whalen. We've got three other coaches that are just remarkable. One played at Notre Dame, Tyson Fraser, and another one's a former Blackhawk, Mikhail Yakubov, and Kevin as well. Just they do a marvelous job. Wouldn't you say, Dr. Bill?
Yes, and in fact, the things that we're discussing, I think they're very attentive. They're very astute, and they practice what they preach, because all these steps could take. Proper coaching is essential in recognizing all the different ways that we can prevent injuries. And I agree with you. I mean, we're fortunate to have quality coaches, and I think it's very important, as Dr. Joseph stated, that at every level of play, particularly as the kids get older, contact sports, it's even more essential.
Good stuff. Doc, we're out of time. Appreciate your help. And again, the Hadesman Orthopedics in Elmhurst is where Dr. Bill Hadesman hangs his hat, and we've enjoyed the conversation.
Dr. Bill, thanks for getting up with us this morning on a Saturday.
Appreciate it.
Well, I appreciate being with you guys. I really do. Thanks a lot.
All right, we'll see you at Nationals next weekend, Doc, for our sons continuing on with their hockey careers. Let's take a break. Coming up next, our staple of the show, Ask the Doctor. You're listening to Sports Medicine Weekly, only on 670 The Score. Hey, Dr. Cole, what are you eating?
Actually, I'm having one of Karen Malkin's transformation bars, Steve, if you might ask. I've actually stocked up on these and keep them in my locker. It gets me through those long days of surgery. They're full of cashew butter, 11 grams of protein, so I want something that's rich in protein. Doesn't have much in the way of, if any, really, in simple sugars. And it's got 12 grams of fiber, so we know how good that is, right? So it's super clean. I don't get that post-glucose surge and get hypoglycemic when all my insulin goes crazy, so that keeps me awake. So it's been great through my long days of surgery. I love it.
They're vegan and gluten-free, so no stomach issues. Can't be having that when you're operating, right?
No, that's true.
All right, why are they called transformation bars? Do you suddenly transform into a super surgeon?
No, Steve, I'm already there, okay? But they do keep me going all day.
So Karen specially designed these bars for her 14-day transformation challenges, since other bars in the market didn't meet her standards. You just one-click order them from Amazon. Pretty sure they do transform you into a super surgeon. All you need is a cape.
There you go, Steve.
You're listening to Sports Medicine Weekly with Dr. Brian Cole and Steve Cashel on 670 The Score.
Back here on this Saturday morning, Sports Medicine Weekly. I'm Steve Cashel with Dr. Charles Bush-Joseph, filling in again this week for Dr. Brian Cole. And time now for the staple of the show, our Ask the Doctor segment. It's very easy. If you've got a question, even a topic that you want us to discuss, please feel free. Go to our website, sportsmedicineweekly.com, and on that homepage, you go to the right side, and you'll see the picture of Dr. Brian Cole and myself, and just click on underneath our picture, and you can ask the doctor a question. We always get lots of good questions from our listeners, and first one, Dr. Chuck, here we go. This comes from John, and you've got to explain who this person is, as he talks about a specific doctor right here. What are your thoughts, Dr. Charles Bush Joseph, on Dr. Paletta's primary repair on elbow?
Steve, this is an interesting one that's kind of come up over the past 3 to 5 years. And really, Dr. George Paletta, who's the head team physician of the St. Louis Cardinals, has published on it recently. Although, actually, one of our team physicians, Dr. Jeff Dugas, down in Birmingham, Alabama, is actually really one of the guys who developed this technique. And really what we're finding that in professional athletes, and certainly high-level college athletes, when they injure their ulnar collateral ligament, or their Tommy John ligament, as we call it, we have to replace it because the ligament's usually damaged, it's not repairable, and it's a long recovery. So you hear about our athletes, certainly on a major league level, are out anywhere from 12 to 15 months. What we found out over the past couple of years, and newer evidence by Dr. Paletta kind of confirms this, is that in younger, healthy athletes, usually high school age, if they have an acute traumatic injury and they tear their ulnar collateral ligament while pitching, usually in a baseball game or in practice, that we don't have to always replace it, we can just repair it. And instead of a 12 to 15-month recovery, we're getting these kids back really throwing and even competing at about 5 to 7 months.
Wow.
Now, we're not sure how this would hold up in the long-term scheme, and so certainly on a high-level Division I or professional athletes, we're still doing reconstruction. But this is really the treatment of choice now for these younger athletes that want to play their senior season or even play some Division II or Division III college ball.
That's interesting stuff. So this doc has his own name. Have you done any of those? I mean,
yeah, I do quite a bit of. I'll probably do
right?
10 to 15, probably this spring sometimes. We're unfortunately entering the baseball time of the year with all with spring and everybody's high school seasons are up and running. This is the time the kids get hurt.
All right. So what's again the determination between doing the full blown Tommy John surgery and then just the repair?
It's two factors. Number one, it's the age of the patient. They're younger, they have better healing capacity, but most importantly is the nature and quality of the ligament. So if we had an acute injury on a previously normal elbow, those ones we just repair. If the young athlete says, I've had a sore elbow for 6 to 9 months and now I just can't throw at all, it's really gone, those are the kids where the ligament, the tissue's poor, and we actually have to do a replacement or a full Tommy John.
How's the repair done then surgically?
It's pretty similarly surgically. It still requires an incision. It's an outpatient operation. It's just everything's accelerated. The rehab, instead of having to wait 4 months before we even allow the athletes to start playing catch, we can let them start playing catch at 2.5, 3 months. So it's a healing process as opposed to a replacement process. So the blood supply to the tissue is inherently better, and just it's a better healing potential.
Okay, one other question on this: a guy like Kopech. Okay, you did the full blown out UCL Tommy John surgery. On the professional athletes, would you consider the repair, or for a young guy like that who's going to be a star, it's better to do the full Tommy John?
We're going to do the full Tommy John. In a player like Michael at that level, we're looking for the most durable solution. And so we think that there's really nothing better than a full-blown Tommy John or replacement. Again, this goes back to high school kids. I want to get back to my senior season. It's my last chance at playing competitive ball. After that, I'm going to move into my, to my men's league or softball season. So, again, for the acute young athlete, this is really a good solution nowadays.
Great stuff. All right, question 2 here comes from Dave in Lincoln Park. With so many conference tournaments taking place right before the NCAA tournament, we had those a couple weeks ago. What are your thoughts, Doc, regarding these young athletes playing so many back-to-back games within a 10-day span? Really, some of these tournaments, some of these teams might play 5 games, right? If you keep winning and you started on Wednesday.
Well, now that we're into the to the big dance in the NCAA, we're past the the tournament, the conference tournaments. But I think what you see is, the injury rate is higher for these kids. And I remember, I'm a Big Ten fan because I grew up and went to Big Ten schools. Watching the teams that played those multiple games, they had to play that Wednesday, Thursday game before they played the Friday, Saturday game. Those guys are just running out of gas. And so certainly their overuse injuries, if they had them, we're sort of acting up on them. They're losing some of their hops or jumps. But more importantly, which like we know in a lot of younger athletes, fatigue does raise the risk of acute injury. So there's a chance that all these players and their coaches and trainers are taking. But by the same token, if this is your opportunity to play in the big dance, you're going to take that chance.
Absolutely. What are the biggest concerns? What are the challenges? What injuries pop up? I know Dr. Cole and I have talked about this, the fatigue factor, right? More ACLs are torn in the fourth quarter, and that makes sense, right? I mean, remember Derrick Rose's, right? Well, how much? You have 2 minutes to go in the game or something? 2
minutes left in the game. And unfortunately, what a change of course of history that actually led to. For most of the athletes, yes, as they fatigue, instead of landing down with their knees flexed and good body position, they're coming down more on a straight leg. A lot more you see guys coming down and they off a jump and they're landing on another player's foot and they're rolling their ankle hard. Usually because just those supporting muscles are fatigued and don't react as fast or as quickly. So again, that kind of goes back to our younger athletes, certainly our high school and our junior high athletes. We have to, as coaches, recognize that these kids are not infatigable and that there are times we have to give them rest, really for their safety as much as anything else.
That's Dr. Charles Bush-Joseph, the orthopedic surgeon from Midwest Orthopedics at Rush, filling in this week for Dr. Brian Cole. Dr. Chuck was a long-time head team physician with the Chicago White Sox, still works with the White Sox and, of course, the Chicago Bulls. I'm Steve Cashel. You're listening to Sports Medicine Weekly and our Ask the Doctor segment. Again, if you want to get involved, go to our website, sportsmedicineweekly.com, click on the homepage, and underneath the picture of Dr. Brian Cole on the right side of that homepage, you can click on that link and ask the doctor a question. All right, question 3, Doc, in this segment. Do you recommend, and please explain what this is, because I know what it is, but you can explain it better than I can, chondroitin for achy joints. Do you recommend chondroitin for achy joints?
Steve, I think I do, and I'll tell you why. Chondroitin and glucosamine, they generally comes together. And so when you see all these supplements over the counter, and it's an over the counter, you can get them at Sam's or Costco's or Walgreens or anywhere. Glucosamine and chondroitin are two essential elements that the body produces naturally itself to help nourish cartilage. And so the thought process it goes back to the old Linus Pauling theory that, vitamin C helps me fight off viruses and colds. So if I take massive amounts of vitamin C, that I'm increasing my resistance and lowering those episodes of cold and flu. Well, unfortunately, the science doesn't really bear it out. And if you look at a high level of evidence, taking glucosamine and chondroitin supplements, really there's not strong proof that it really helps or that it actually certainly does not regrow cartilage. But if you look at large population studies, like in Europe, where they take 3,000 patients who have arthritis and they've got sore joints and they take glucosamine and chondroitin supplements, probably about 50% of those patients feel improved, have better quality of life and better activity scores. Now, half of that may be biologic effect, half of it may be placebo. So what we don't know, but what we do in practice, or what I do in practice, I tell everybody, it's worth a try. There's very little downside to taking these types of natural supplements, especially glucosamine and chondroitin. And you got to take them for anywhere from 4 to 6 weeks. Usually it says 2 or 3 capsules once or twice a day to really know whether you're getting benefit. And surprisingly, a number of patients say yes. And some patients say, no, doc, I took it for 6 weeks and I stopped and I didn't feel any difference. So I think it's really worth a shot. There's no downside to it because it is, quote, a supplement as opposed to a drug. I think if you're arthritic or you got chronic achy joints, take a swing at it.
What are we looking for in ingredients? Anything jump out? I mean, are all those companies that making chondroitin and
glucosamine?
Yeah,
I would
say
are they
the same.
There are varying manufacturers with varying quality. As long as it has glucosamine and chondroitin and you think it's from a reputable manufacturer, that's what it needs. Now, several of the brand companies try to differentiate themselves by one adds a little magnesium, one adds a little vitamin E. There's things that they do to differentiate themselves in the market. But as long as it's got glucosamine and chondroitin, those are the essential elements you're looking for joint health.
All right, final question from our Ask the Doctor segment. What are nightshades?
You know, nightshades is a vegetable. It's a whole class of vegetables. Usually includes tomatoes and peppers, red peppers, eggplant parmesan. Those are all nightshade type vegetables. And nightshades generally have a single compound called salacinine, which is a sort of a chemical that some people think, or there's some I hate to say old wives' tales, that nightshade vegetables can aggravate or propagate arthritic problems, especially patients with autoimmune disease. Generally, that's not the case. Most people that have problems with nightshades usually have food sensitivities, and nightshades actually can cause considerable problems. And I'll go to my wife. My wife, Vicky, was one of them. She loved tomatoes. We ate tomatoes like crazy. We had a garden in our backyard, and she breastfed, and our first 2 kids just screamed and screamed and screamed. And she figured out, I better stop eating tomatoes, and our third child had no problems. And so that's actually a pretty common response. Most people that have problems with nightshades usually it's due to food sensitivity. And if you're having medical ill issues, whether it be gluten-free or all these other types of diets that many of our experts on this program have advocated, nightshades is one of those food classes that you're going to sort of trial in and out on.
Great stuff. Dr. Charles Bush-Joseph filling in this week for Dr. Brian Cole. Great to see you, Dr. Chuck. Thanks so much for your help.
Steve, always a pleasure to be here on a Saturday morning.
Appreciate it. Our producer, Shane Reardon. Our coordinating producer, Teresa Ann Seeger. Many thanks to David Cole for running our website and our business operations. Also, Samantha Smith from Midwest Orthopedics at Rush. For Dr. Chuck, I'm Steve Cashel. Thanks so much for listening to us here on Sports Medicine Weekly. Be back with you again next Saturday, 8 a.m. for another edition. Coming up next, it's Early Odds with Joe Ostrowski. Talk with you again next week for Sports Medicine Weekly, only on 670 The Score.
You've been listening to Sports Medicine Weekly, heard every Saturday morning at 8 with Dr. Brian Cole and Steve Cashel, only on Sports Radio 670 The Score and 670thescore.com, Chicago's sports station.